Air quality and health. How do pollutants affect our health? The levels of pollution that affect our health are set by the National Ambient Air Quality Standards, NAAQS, of the Environmental Protection Agency. They have a review process that includes scientific studies, risk exposure assessment, public comment, interagency reviews, etc. What are the health effects for criterion toxic pollutants? Those of particulate matter, ground level ozone, carbon monoxide, sulfur oxides, nitrogen oxides, lead, benzene, black carbon, ethylbenzene, hydrogen sulfide, toluene, and xylene. Ozone irritates airways. The symptoms are cough, sore, or scratchy throat. This slide provides much more detail on short-term ozone exposure and the respiratory effects. This study found that increases in ozone resulted in an 83% increase in school absences. Particulate deposition from particulate matter shows that PM10 deposits in the upper respiratory tract, and particulate matter like PM2.5 are inhalable and penetrate the lungs. Particulate matter smaller than 0.1 may enter directly into the bloodstream. Sensitive groups for particulate matter are people with cardiovascular disease, lung disease, older adults, children, and those in a lower socioeconomic group. The Veterans Affairs study published this year has found that, quote, the global toll of diabetes attributable to PM2.5 air pollution is significant. Carbon monoxide exposure reduces the capability of blood to carry oxygen, thereby decreasing the supply of oxygen to the tissues and organs such as the heart. Sulfur dioxide affects people with asthma. Short-term exposure is linked to respiratory symptoms in children and are often related to ER visits and hospitalizations, particularly for children and older adults. Nitrogen dioxide exposure results in respiratory symptoms, especially among asthmatic children. The toxic pollutant benzene causes eye and skin irritation, headaches, dizziness, etc. Longer exposure can cause bone marrow damage and blood diseases like leukemia. Black carbon is related to asthma attacks and problems with the heart and blood vessels. Ethylbenzene at short but high levels can lead to eye and throat irritation, dizziness. Long-term exposure can cause kidney and inner ear damage. Hydrogen sulfide produces a rotten egg smell, and short-term effects include nausea, watering eyes, headaches, sleeplessness, breathing problems, digestive upset, and tiredness. Toluene exposure can result in irritation of the eyes and nose, confusion, headache, dizziness, and insomnia. More serious effects can include kidney and liver damage, and it may also be linked to infertility. Xylene exposure can cause headaches, lack of coordination, confusion, and dizziness. The Bay Area Air Quality District's May 2016 Planning Healthy Places Guidebook includes Benicia for implementing best practices to reduce exposure.